Malaria is a serious and sometimes fatal disease caused by a parasite that usually infects a specific type of mosquito that feeds on humans. People who get malaria are usually sick with high fever, chills and flu-like illness. Causes: malaria is caused by a type of microscopic parasite. The parasite is transmitted to humans most commonly through mosquito bites. 4 kinds of malaria parasites infect humans: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Plasmodium falciparum is the type of malaria that is most likely to result in severe infections and if not promptly treated, may lead to death. Although malaria can be a deadly disease, illness and death from malaria can usually be prevented. Mosquito transmission cycle. A mosquito becomes infected by feeding on a person who has malaria. If this mosquito bites you in the future, it can transmit malaria parasites to you. Once the parasites enter your body, they travel to your liver, where some types can lie dormant for as long as a year. When the parasites mature, they leave the liver and infect your red blood cells. This is when people typically develop malaria symptoms. If an uninfected mosquito bites you at this point in the cycle, it will become infected with your malaria parasites, and can spread them to the other people it bites. A malaria infection is generally characterized by the following signs and symptoms: fever, chills, cough, sweating, headache, nausea, and vomiting, chest pain, abdominal pain, muscle pain, fatigue. Treatment of malaria falls into 3 different categories of drugs depending on the stage of parasite in the body. These categories include tissue schizonticides. These drugs kill schizontins in the liver. For example, primaquine. Blood schizonticides. These drugs kill parasitic forms in the blood only. For example, quinine, chloroquine, artemisinins. Spironicides. Spironicides prevent sporangian multiplication in the mosquito. For example, preguanil, pyrimethamine, etc. Complications. Malaria can be fatal. In most cases, malaria deaths are related to 1 or more serious complications, including anemia. Malaria damages red blood cells, which can result in anemia. Organ failure. Malaria can cause your kidneys or liver to fail, or your spleen to rupture. Any of these conditions can be life-threatening. Hypoglycemia. Severe forms of malaria itself can cause low blood sugar, as can quinine, one of the most common medications used to combat malaria. Very low blood sugar can result in coma or death. Cerebral malaria. If parasite-filled blood cells block small blood vessels to your brain, cerebral malaria, swelling of your brain or brain damage may occur. Cerebral malaria may cause seizures and coma. Breathing problems. Accumulated fluid in your lungs or pulmonary edema can make it difficult to breathe. If you live in or are traveling to an area where malaria is common, take steps to avoid mosquito bites. Mosquitoes are most active between dusk and dawn. To protect yourself from mosquito bites, you should cover your skin. Wear pants and long-sleeved shirts. Sleep under a net. Bed nets, particularly those treated with insecticide, help prevent mosquito bites while you are sleeping. Apply insect repellent to skin and clothing. Sprays containing DEET can be used on skin, and sprays containing permethrin are safe to apply to clothing. If you have any queries, feel free to ask in the comment section. Like, share and subscribe to the channel so that you don't miss any new videos. Thank you for watching the video.